Welcome back. Well, 23% of all adults, or more than 54 million people, have arthritis. By 2040, those numbers are expected to grow to an estimated 26% of adults, which is well over 78 million people in the United States. And one of the most common and particularly painful places to have arthritis on a part of your body that you use constantly, every day, all day, is your thumb. And joining us now to talk more about this is Dr. Kitay. He is part of the team at Jacksonville Orthopedic Institute. So good to see you. Thank you for being here.
It's a privilege to be here. Thanks for having me.
So arthritis affects a lot of people. You're an orthopedic surgeon, but you've done additional training with your specialty to really focus on some parts of the body that can be particularly painful for people who suffer from arthritis.
Yeah, that's absolutely correct. So after I completed my training in orthopedics, I did additional training to take care of more complex conditions of the hand, elbow, and shoulder, and I also do have a certificate of added qualification in hand surgery.
And do you see a lot of patients coming through your front doors talking about arthritis, particularly in that area? I mean, the opposable thumb, right?
Exactly.
We use it so much.
Exactly. It's really one of the features that separates us physically from the other animals. Our thumb moves, and because it moves so much, there's more room for error and problems. So it's vital for pinch and grasp, and because it leads to failure in different ways, people often do have problems and complain of pain right there, and it requires treatment.
Yeah, and we're going to get into the treatment in just a second. So what is it about this area that you find a lot of patients coming in? What's causing the pain, I guess I should say?
Okay, so today we're talking about the most common cause of the pain, which is wear and tear arthritis, or osteoarthritis. And that's where the normal joint has a lubricating, kind of smooth gliding surface called cartilage. And in the typical thumb arthritis, that cartilage is narrowed, worn down, and instead of having that gliding surface, the bone-on-bone contact, and that's what causes the pain and swelling and difficulty performing normal activities.
And is there something that we're doing that's causing this that we could not be doing to prevent this from happening, or is it just kind of like it just happens?
That's a great question. It's, for the most part, we don't know a way to prevent it. It's much more common in women than men, 10 times more common.
Oh,
sorry.
Wonderful. Thanks
sorry.
a lot. Yeah, add that to the list of
Right.
wonderful things.
An additional burden.
Right.
It's more common as we age. And in postmenopausal women, something about probably more than 1 in 10 will have symptoms from this wear and tear arthritis. And we think it has to do with the fact that the joint is so mobile. And as the ligaments, what allows mobility? The ligaments. And as the ligaments that connect the bones together loosen or become injured, then that mobility is excessive, and that leads to shifting and then the wear and tear.
Okay, so let's talk treatment options. So it happens, there's not really anything that we can do to prevent it. Some people are more prone than others, women, you know, well, here we go. So what can you do to help ease people's pain when it comes to this?
Right. Well, the first thing we do is we try and rest it, activity modification. So there's certain things that make the pain worse. So typically the patient will come in presenting and complaining of pain right in this area over here, in this area over here. And we want to try and minimize the stress placed on that joint. So sometimes it happens more from pinching and even holding a pen. So you can get some people use those grips that make the pen wider. In addition, splints can help over half the people that immobilize this joint. And I did happen to bring one with me.
Yeah, why don't we go ahead and show that? We'll try to zoom in on the camera and show people at home. And as you're doing that, resting, will that heal or help if you just stop exacerbating the situation? Will it make it better?
It will make the pain better, but it will not change the disease. But it makes it so that it's tolerable. And what we want to do is help with the pain. So here you have it.
Okay.
This is the joint. I can't move that joint. I can still use my thumb. I can still pinch. I can still grasp. But often it protects this joint from further irritation. So that's the first line of treatment: activity modification, splinting.
What do you do beyond that? If the splinting doesn't work and you're taking, you know, acetaminophen or ibuprofen and you just like, enough of this, what's the next step?
So, like you said, the ibuprofen, and there's other medications, and then sometimes we head towards injections. And you may have heard of different kinds of injections, like hyaluronic acid or viscosupplementation or platelet-rich plasma, PRP. That has not been ever shown conclusively, scientifically, to do any better than steroid injections. So it's very common for me to do a steroid injection into the joint here, and that does lead to relief, although it's not Permanent relief, it can help for weeks and even months. And that would be the next line of treatment. And if that fails and the patient's still having significant problems performing their normal activities, then there are surgical approaches.
Yeah, there is. So there is relief for people who are suffering,
Yes.
because I know there's some people out there that just don't want to address it. Maybe it'll just go away.
Right.
But it's not going to, the underlying condition, until you do something about
Yes.
it.
The great news, if it comes down to it, 95% of people or more can be cured with an operation.
There you go. Dr. Kitay, so good to see you, sir. Thank you for being here. We really appreciate
My pleasure.
it. And for more information, you can always log onto their website, which is simply joi.net. You can also call their San Marco location. The number is there on your screen, which is 904-858-6400, or 904-JOI-2000, which is actually the one that's on the screen. That's correct. So you can ask for Dr. Kitay, especially if you have any arthritis problems. Thanks, sir, for being here. Appreciate it.